Welcome to the Healthcare Intelligence Podcast, John. John actually has been in healthcare for a little bit over 3 decades. Right now, he is the CEO of Bone and Joint Institute of Tennessee, and he has done a lot of different things. We'll unpack them, but for now, I just want to say thank you. Welcome, John.
Great. Thanks, Charlene. I'm really looking forward to today's conversation.
Yeah, and before we start, can you just give us a really brief overview of what you have done in healthcare so far?
Well, like you said, it's been over 3 decades, actually, exactly 32 years. So, started out in orthopedics, working with a small physician group, and then went to several hospital systems, running medical practices for them. Spent some time with a physician practice management company, and came back to the hospital side of things now. And a little bit of physician management, value based care is now the hot topic, looking at direct to employer contracting and how we're using AI, artificial intelligence, to implement it across the platform.
Right now at Bone and Joint, you're also owned by health system, right?
That's correct. Yeah.
So,
So,
yeah.
no, I mean, we're owned by a health system, and it's a large health system in Middle Tennessee. We are the orthopedic platform for it.
I think one thing that people often talk about the future of independent practices, whether it's like provider owned, partnership, private equity, many different model. Would love, and I know that you have been through different models in the past. Like, would love to hear a little bit more about what's the pros and cons for the current structure. Like, how do you see it?
Yeah, for us here, honestly, this is something I tried to achieve over my career, especially the last couple of decades. We were constantly the practice I was at. We were constantly fighting the battle of being able to have resources, both technologically and financial. To be honest with you, so being part of a health system, it gives us access to technology, a whole IT department, whole data analytics department at the health system, access to capital to drive the processes that we need, and that's the biggest plus to it. I really, at this point, I don't have any cons.
It's awesome. And then one thing since you mentioned both financial and technology, I know you are one of the most innovative leaders in the orthopedic side. Um, I think both from like patient access, front end, scheduling, quality. Would love to hear a little bit more about what have you tried across the board.
Yeah, so they say you can't teach an old dog new tricks, but I'm trying to put that to bed. For me, I've embraced artificial intelligence across the board. If you look at it from the revenue cycle and how it impacts the health system, it starts in the beginning. So I'm looking at opportunities, number one, that make a better patient experience. Ultimately, that helps with the bottom line cash flow. So you're talking about scheduling. Really, it starts with our call center. So the call center, we've used some AI products to assist that team from a scheduling standpoint. Then when the patients actually arrive, all the way through seeing the patients in the clinic, I've always said that a doctor can do everything right at a patient visit, but if they had a bad encounter on the front end or at checkout, that defeats the whole visit. So what we've tried to do is implement or deploy AI across the system so that it enhances their job. I'm not trying to replace staff. I mean, I may redeploy people in other areas of need. And by virtue of our growth, we've been able to do that.
And I think that's one thing people often are afraid of in terms of change management, right? Because like they think it will be their job may go away, maybe very different. Like, how do you approach workflow change and change management when you're bringing in new tools?
Yeah. So I'll give you an example. The first time I introduced this to the staff was at an all staff meeting. And 15 minutes after the meeting, I had three doctors calling me and saying, "Oh my gosh, my staff just came back to me and said you're eliminating their positions and that you're cutting them out and you're going to use AI to replace them." I was like, "No, it's not what I said. What I said was that I wanted to enhance their roles." So it's about communication and alignment. I'm a strong believer that you cannot communicate too much. I want all parties involved. I want everyone from the front end all the way to the back end. Again, the schedulers to the clinicians. Everyone has to buy into this. And we have regular meetings. We meet every Thursday and we talk about um, operational issues because the implementation of AI across the board for us, it's both financial and operational. But if you don't have all parties involved, it will not be successful.
And I think that touch upon like the implementations that you have done in the past. When you were rolling out, what were some of the challenges that you have run across, both on the product and people side?
I think really it's been more on the people side. Um, Generally, the products are going to work. That's not the issue. It's getting the buy-in from the staff. And for me, when I got here, I've been with this group a little over right at 2.5 years. And what I found was that there was one product in particular in regards to surgery scheduling and surgery, the whole follow through process and data outcome. We spent a lot of money on it, but no one championed the cause. There was no physician leadership involved in it. It was a bright shiny toy that no one wanted to play with. So for me, to really, I started looking at it after 2 years. We're starting to re-engage with that company, and it's been eye-opening. Really, that's what it comes down to. You you spend all the money on this, but if you're not engaging, I mean, if you're not buying into it, it's not going to work. And that's what I really push on my team is um, stay involved. Not every system is going to be the perfect system. I understand that, but work with the companies that are providing these products to us. I mean, they need the information. They want the feedback as much as we do.
Yeah, I think that's, I mean, in those cases, I was like, well, how does the deal get closed? But the other thing is also success is key, right? Because especially these days, and I think I would say maybe in the past, the product is rather static. Like you buy something, you get it. But now the product is changing very often. If even if the look and feel is the same, the underlying model is changing very often. So I'm wondering, like, have you seen like any new working model that you have seen in place with your either the vendor ecosystems or internal team that have been like I would say brought up as a result?
Every day we're seeing new opportunities. That's what I'll say. And just this week, we have probably gone through 5 or 6 demos of new products. Now the question is, they all look great. Are they going to perform? I think I've overcome the getting my staff engaged. I've won that battle.
You
I
still
feel
have
like.
that.
Yeah, yeah. So, but we still, you can't just sign up with everyone. So what I'm actually doing is working with a group of folks that more from a consulting standpoint to guide me, help me, make better or more informed decisions. Um, Again, there's so many products and the technology is changing so fast. One thing I look at is one product another product that I've re-engaged with. I looked at them 2 years ago and they're completely different this week than they were 2 years ago. And I like it much better now. So that begs the question, you know, how long of a deal do you sign on the technology in long term? In what is long term? Is it 1 year? Is it 2 years? 3 years? We're still trying to figure that out.
Yeah. And I also think like hopefully even within the shortest term, things are improving quite a bit and you're locked into a good price for the year at the very least.
Right. Yes.
And then since you mentioned a lot of workflow change, I do want to bring in surgery scheduling. I do want to bring one up, which is prior auth. That's
Yeah.
probably the number one thing ortho a lot of ASCs will ask about. So how do you currently handle that process today?
So, I mean, we're a very high volume practice. And whether we're talking about pros for surgery or even MRIs or any type of procedure, that's been a challenge. And when I arrived, there were unfortunately patients going through the system that we didn't get a PA on. And ultimately, we ran into issues from a reimbursement standpoint. Either that or you were fighting the battle and trying to get a retro authorization, and you don't always win that battle. But it took so much time. There's a lot of AI products out there now that are simply set up for assisting you with prior authorizations or denials, and I'll say some of it, some of the low hanging fruit. That's where I want to use these systems or these platforms because my people, again, being as busy as we are, if we can use AI to handle or to work the low hanging fruit, it allows my people to be able to handle the more complex things. It also, and I just had this conversation this morning with my director of operations. We were going through some different reports, and there was so much variability in the staff, their report or their metrics. And I was like, all right, if we're using an AI product, hopefully we're all singing off the same page, or the system is. It seems like each employee is singing off a different or singing a different tune. And that's something that I'm trying to rectify.
What's causing that?
I think it's more of I think it's multiple things really. Um, do we need to do a better job of training our staff? Probably, yeah. I mean, I'm a huge proponent of you learn something new every day, and it's followed through. There has been, I say I feel like I've won the battle of getting everyone to buy in, but there are still opportunities there. Some people, quite simply, still, they've worked in different organizations and come to us, and they maybe they did something differently where they came from, and it's a process of getting to learn our system. Um, Hopefully, follow through and accountability is going to solve that problem.
And I think the other thing, probably taking a step back and coming back to why you are such a leader in the space. I think you mentioned something with the pressure from the other side. So we'd love to hear more about how you see the landscape on the broad stroke as well.
Yeah, everything is changing so fast, and we've heard that so many times in healthcare. I, in my career, I've seen so many different things within the last year with I don't know, call it what you will, the AI revolution, or it's changing so fast. And either we're going to adopt AI or we're going to get left behind. And, again, not every system is perfect, but we've got to be able to embrace it and understand it. Now, with that comes, from the um, uh, from a compliance standpoint and legal standpoint, all these different things that you have to look at and say, all right, is this information correct? I read some of these stories about you got to be careful with AI because depending on how you ask the question or whatever, it's going to give you varying answers. But um, technology change being what it is and as rapid as it is right now, that's a huge challenge for all of us. I think, this was a question one of my doctors posed to me recently. He said, who's leading the AI revolution at Bone and Joint? And I was like, well, I am. And he said, who's going to carry it out? I said, well, I am. And he said, it's got to be all of us. And I said, I agree with you.
You have a
And
champion right there.
yeah, right. And that's the way I looked at it. I was like, okay, between you and me, we'll make this a success. And that's the goal.
how do you see payers reacting to what you're doing?
Yeah, so I've always said the insurance payers, I mean, as far as us getting paid, it's a game. I mean, it's a dance that we have to learn, and it's ever changing. Every other healthcare administrator knows this. They'll tell you this. You know, it's what we're seeing again goes back to the rapid change in technology. You have the payers that are using AI to deny claims. It's deny, deny, deny. It used to be a person doing it. Now it's you have AI systems doing it. So it becomes an arms race where we're having to come up with a better system. Um, Payers, I get it. I understand what they're doing. Um, but it does put additional challenges or hurdles in place for us to overcome.
Did you find that in the numbers you see? Because I know that you have a very, I would say, successful, but also a little unconventional way of reporting, like tracking how things are working. Like, do you see that in the numbers?
We track a lot of data here. And again, being part of the health system, that helps us do that. Every day I'm looking at, I'm old school. Every day I pull up schedules and see who's busy or who has openings in their schedule. Fortunately for us, we don't have a lot of that. But how does that translate into the bottom line, into the revenue side of things? So we have internal through our EHR system. We have internal dashboards that we're able to track and measure. But we are piloting a couple of other AI products right now that will assist us on that. Again, the speed of everything. I need to be able to see in real time, not last month. And that's one of the bigger challenges that hopefully I'm able to use AI to help do a better job at what I do.
And one thing you mentioned is this is a game you not only play every day, but you enjoy playing after 30 years. What keeps you in?
I just don't want to get stagnant. I'm always wanting to grow. I'm a lifelong learner. Um, I just enrolled in and I'll be starting a doctoral program in August. So,
Congratulations.
I, yeah, thanks. So, I mean, but, not, I tell my staff this every day. Every day, take this as an opportunity to learn something new. Um, I walk into this office every day with a smile on my face, trying to encourage staff. I've been real fortunate here. Um, this organization really prides itself on being very family oriented, and I feel like we all we all abide by that. We all believe it, and I think from the standpoint of carrying the message across that you know um, every day we want to learn something new. Every day, let's be excited about something. We engage with our staff. Next week we're having a cookout out in the parking lot, and we do events with our staff. So every day it's trying to keep it fun. I like to smile, and hopefully everyone else feels the same way. At the end of the day, we still have a job to do, right? And my two big things that I push all the time is accountability and really follow through. And I feel like the staff here believes that. Being uh, a very fast growing and busy practice, it makes it a good challenge, but it also makes it fun.
And I love the team morale because I feel like at the end of the day, it's the people that matters.
It is.
Right. No matter technology will come, it will be better, it will go, but the people stays.
Yeah, and that's the fun thing about this, even with the technology, with the AI products and EHRs. I mean, the funny thing is, I sat in a meeting a couple of weeks ago, and we have a lot of younger staff here, and we were sitting in a room, and I asked each one or everyone in the room, I said, um, we were preparing for EHR downtime or internet downtime, and how we will be ready in the event of that. And I said, how many of y'all have ever worked with a paper chart in an office? Me and maybe two other people were the only ones that raised our hands. And everyone was like, oh, you can still see patients in clinic without an EHR? I'm like, yes, we can do this.
You have a multi-generational workforce there. I think, yeah. I mean, surprisingly, EHR downtime still happens these days. So that's why we need a lot of pen and notebooks in the office.
That's right. That's
Yeah.
right.
Well, John, thank you for joining today. It's such a
Absolutely.
pleasure.
Charlene, I
Yeah.
really enjoyed it. And, it's a fun time to be in healthcare. You know, let's, we're doing great things and it's a challenge, but I thoroughly enjoy it.
If our guests want to find you online, what's the best way to see you?
Easily LinkedIn. You can find me on LinkedIn or even go to our website, bone and joint, tn.org. Easy.
Awesome. Well, we'll also put those information in the
Okay,
bio so
great.
people can check it out.
Awesome.
Cool.
Thanks, Charlene.
Thank you.